Hey, this is Dr. Ben Pearl with FitFootU. So today we're going to be talking chronic knee injury. I have an ACL deficiency on my left from 2001, soccer injury, and now when I play on turf, I'll get some inflammation in the meniscus area, a little bit in the joint. So I'm going to do not prehab, but a little post-recovery / rehab. Now, one thing that we're going to take as a sidebar is the different muscle pattern that fires after you have an ACL deficiency. It actually changes your brain pattern. So you're going to see on my VMO right here, a little bit of a lag. It's a little soft when I contract it. So I try to do some VMO exercises, squats, hamstrings, and we do some VMO specific exercises. But sometimes you need a little bit more engagement. Let's take a look at the brain pattern that happens after this ACL injury.
Red is the ACL activation pattern of our ACL patient, and in blue is the brain activation pattern of a healthy match control patient. So you almost don't have to run the statistics to do that simple quadriceps dominant knee extension task. You can see our ACL patient engages in a lot more red than blue. They have to bring in a lot more brain regions. They have to activate those regions with a higher degree, more rate coding, more neurons firing than our healthy matched control patient. Which the data you're seeing is just one patient versus another patient. And these were the Division I collegiate level soccer players, and the young lady was returned back to her sport. So the lady in red, she's playing Division I collegiate soccer, but she has to activate all of these accessory brain regions just to generate a quadricep.
So use it or lose it, I always like to say. You can see there's a little deactivation that occurs after these injuries, and it becomes habitual. So I'm going to use my PEMF machine that I happen to have in my office. I'm going to get a little activation. I'm going to start this at about 35 on the intensity. So this goes up to, and I'm seeing on the phone there's a little pulse. So even though we're this far away, it's interfering. There's a little rheostat going on the phone itself. I see a little, almost looks like a strobe light. So I'm using it on my knee. I'm going to get a little activation on that VMO. It is contracting the knee, so it is helping with that deficit. And then in a minute, I've got another new tool. It just relaxed. Now it's going to the slower frequency here. But you might see the knee pulsating, maybe not. I'm going to just try to reorient this so we have it at a little bit sharper angle for you to see what's actually happening on the knee. You'll see a little vibration. That's as the muscle itself is being activated. Little slight pulsation of the muscle. There we go. Now it's tightening up a little bit because it's a faster frequency. What we're going to do next is the Shockwave. We're going to work a little bit more on my joint. Brand new Mercedes right here. We got to take it up. This is the Softwave. There's the brand. Yeah. This also has coverage for wounds. And we're going to get this baby activated. We're going to start up the fill process. Now when we finish, we got to drain the fill. It kind of looks like a flashlight. I call it the Statue of Liberty play when we finish, but it's starting to fill up with the water, which serves as the vehicle for the Shockwave. This is different than the pressure waves. I own one of those as well. Another good machine. You're going to see the lip there, and we filled up. Now we're going to double pump engage this. I'm starting at a setting of 9. I'm going to double click this. And away we go. Here we go. It's a little intense. As they say, no pain, no gain. I am going to take it down a little bit. We're at level 9. It is getting a little mild irritation when I get into the joint line there. Adjustments we make in the clinic. So let's take it down to, well, that's higher. Let's take it down to 7. There we go. Gotta hold your thumb on it. All right, so we got level 7. I'm basically at the knee joint itself, getting a little bit into the VMO. They're about $3 alone, so you want to make sure you use your shocks wisely. So let's get it started. We'll do the double click. Wow, I did that with my pinky. I didn't think I was going to be able to do that. All right, here we go. Tail's not too bad. My pain is right there. It's like a divining rod. That's the hot spot. You can see the little flash. That's an electrohydraulic charge. This is kind of like submarine charges, depth charges. So the difference between this and the machine I have in the other room there, they're about $3 alone. So you want to make sure you use your shocks wisely. So let's get it started. We'll do the double click. Wow, did that with my pinky. I didn't think I was going to be able to do that. All right, here we go. Now we're getting a little bit more on the front of the joint, patella. Patella's not too bad. My pain is right there. It's like a divining rod. That's the hot spot. You can see the little flash. That's an electrohydraulic charge. This is kind of like submarine charges, depth charges. So the difference between this and the machine I have in the other room there. This is a radial shock wave, so that's pressure waves as opposed to the electrohydraulic shock wave. And hence you see the signal there. So in summary, as opposed to the old days, if anybody remembers the movie North Dallas 40, where to get back in the game faster, they injected you with the juice. Who knew what the juice was? It was cortisone, whatever else they wanted to throw in, give you some amphetamine to go back in the game. Now we've got real, natural ways, regenerative ways to heal. Technology is our friend, folks, in this situation. Till next time, this is Dr. Ben Pearl with FitFoot U.